Across Maine today, hundreds of residents urged support for health care reform and the Employee Free Choice Act. 225 blueberry pies and more than 1,000 letters were delivered to all 17 district offices of Senators Olympia Snowe and Susan Collins and Representatives Mike Michaud and Shelley Pingree. About 50 residents gathered in downtown Bangor this morning to make the deliveries and talk about the fact that while there are some businesses in the state that are well managed, others are not, and those workers should be allowed to form unions.
Members of the state's congressional delegation were treated to blueberry pie this morning, but the sweet treats came bearing a message. The Service Employees International Union is running a campaign called Change That Works. As a part of this campaign, representatives delivered blueberry pies to the offices of Senators Olympia Snowe and Susan Collins, as well as Congressman Mike Michaud and Shelley Pingree. The union supports President Obama's health care reform proposals and the Employee Free Choice Act, and they would welcome the backing of Maine's congressional leaders.
All of this is unacceptable in a society with so much wealth and medical expertise. For people to work so hard for so little and to have the potential to lose so much is a problem that must be addressed at a national level.
Demonstrators also delivered more than 1,000 letters to delegates from people who they say support the legislation. Similar demonstrations were held in Augusta, Lewiston, Portland, and Presque Isle, as well as 29 other states.
This past December, both of my father's parents passed away. My grandmother a week before Christmas, my grandfather on New Year's Eve. At 86 years old, age caught up with him. Over the years, my grandfather had experienced several health issues. After many doctor's visits, different specialists, conflicting diagnoses and treatments, my grandfather was moved into an assisted living facility. My grandmother, in fairly good health, moved into an independent living apartment setting. Unfortunately, due to Maine Care and health insurance companies, they were not able to get on the same page, not agreeing on the level of care each needed. My grandparents spent their final days on Earth living apart. Instead of being able to start each day with a hug or a kiss, my grandmother's day started with a 35-minute car ride to visit my grandfather. Ultimately, how my grandparents spent their final years, married for more than 60, was determined by insurance companies, Maine Care, and Medicare.
Healthcare, like representation in the workplace, is a basic human right. Healthcare coverage should belong to everyone at all times, not just when they're lucky enough to be employed and earning enough to cover the enormous salaries and the inefficiencies of our coverage system.
It's time to make sure every family and every individual get the cover they need, from prenatal care through hospice care. It's time to give Mainers and all Americans the same accessible, affordable health care. Thank you. Now,